I was actually invited to the Health Optimization Summit, and I spoke about mold in front of about 2,000 people on a crowd. So, it's a really exciting topic. And when you talk about, out there, especially England, 900,000 homes are actually dealing with mold issues, and especially level one toxicity in home.
Hello, and welcome to the Energy Flow podcast. I'm Kelly Kennedy, and I am here to discuss all things energy, fascia, lymphatics, oxygen, and water. Over my 26 years of being on this journey and 19 years in clinical practice, dealing with chronically ill, chronically pained, to the optimizing of health, and to everything in between, we have learned throughout these years how to efficiently and effectively teach people how the body works, get them engaged in that system, help them understand how the universe works and how those two connect. And that's what this Energy Flow podcast is about. Whether you are new to us or you've been a longtime listener of over 4 years now, we are so happy and honored to share our heart's honest truth about what we know, what has worked for us, what's worked in the clinical practice, and what might be the key to your next step in your journey. Thank you for joining us, and thank you for sharing this with all that it will resonate with. We look forward to each and every moment of our genuine connection. Thank you for listening. I am so grateful to be here today with my dear friend, Dr. John Kim, who I was just schooled to think. I said, what are we going to teach him on the second podcast? And he goes, it's our first podcast. I'm like, what? So I just truly bring you and invite you all with me today. This is one of the most heart-centered individuals I've ever met in my life. I am so grateful to Dr. Joss for introducing me to Dr. John Kim, who just became John Kim. I want to say 3 years ago now. And
Yeah, 3 years ago, 2022.
And almost, I really set the attention today that as you listen to this pharmacist, yes, he's a pharmacist. Don't hang up yet. Don't hit stop. He's the best pharmacist you're ever going to hear from. And it's because not only is he devoted to his craft as a pharmacist, but he's devoted to his own wellness. And I'm going to let him tell his story and how he got here. But truly, I invite you all into my tribe, and there's few that I consider true friends, and Dr. John Kim is truly a true friend. He's been in my home. We've shared many meals. We've done dancing together. We've played together lots of times. And so it was kind of weird that I was like, what? I've never had you on my podcast before. How is that even possible? So he's an expert in many things, but heart circulation and mold is going to be something we talk about. And I'm really excited to tell you about a recent journey I had, which I'm sure Dr. John can lend a lot of light to. But as always, we trust today that as we speak from our hearts and speak our truth, that those that want to be healed this way hear this and share this message. And those that don't, say goodbye. We love you so much and have a great day. And so it is. Welcome, Dr. John.
Thank you so much, Kelly. I appreciate you inviting me finally. And I'm honored. I am honored to be on your podcast finally. Man, I was wondering, like, when is Kelly going to be inviting me? And I'm just like, oh my God, I got an invite finally.
I can't believe it. I really thought this was our second round, which is very funny because we've had so many intense conversations. I just
we did. We always do. Yeah, we always do. So, I mean, it's one of the blessings to find a friend like you, to be connected, and as well as to share our overall pains of, obviously running a business and helping our patients and clients alike, but also in just to having you in my vicinity in my life as I walk this journey called life, basically. So thank you so much.
He's in New Jersey and we're in Pennsylvania, and we don't get to have a lot of people on our coast. And so when Jess introduced us, I was like, wait, you live where? You live in New Jersey? Oh my God. And it's been very great to have that connection. I agree.
Yes,
and I would just, you and I are very open people. So I just want to share with everybody right before we started this, what we were talking about is the challenge as business owners and healthcare practitioners that we have, that we want to make everything so affordable to everybody, but at the end of the day we also need to afford to do what we do, like the podcast, like continuing education, like creating programs, like hiring more people to coursify all the education, that kind of stuff. And it's challenging. And if it was up to us, I know John would give everything away for free, as would I, because that's really who he is. He really cares. I have prayed with this man, and he really cares about humanity. And I don't get to meet many people like that. So
Thank
I
you.
know it sounds weird being in our industry, but truly would give you the shirt off of his back if he could. And he has helped me out in more times than I can count, in different pinches I've been in, that he has pinch hit for me and helped me knock it out of the park. And that's true friendship, true colleagues, and that's a true tribe member that is devoted as we are to help the client, no matter what it takes, to help them get better and help them remember how powerful and magical they are.
Thank you so much.
So tell them about
So
how you started this journey. I mean, you're a pharmacist, smart guy, went to school, all the things. Tell them that.
it's an interesting journey how we get here, right? It's all about the journey itself. It's not about where you're going to be at the end. It's about the journey of every step. Everything is connected to everyone and every place that you go to. So the reason I got into functional medicine, and it's an odd topic for pharmacists to even talk about functional medicine or integrated medicine, was because I actually experienced the brokenness of actual conventional centralized medicine. I worked in the emergency room as a pharmacy intern, and within the 5 week period, I had this one particular lady dealing with an uncontrollable blood pressure coming in every single week and not able to be helped fully, except for just this is what the issue with pharmacy these days is about pharmaceutical care. And that particular term is about optimizing how much medication we could give to get that symptom under control, except for the root cause issues never talked about. And a funny thing enough, when I was in pharmacy school, where this thing called the JNC7 guideline talks about, it basically is a Bible of how to treat hypertension. And within that guideline, the first thing it tells you to is do lifestyle matters, right? Eating well, sleeping well, stress, exercise, including telling patients to fix their metabolic issues. But the issue is within the centralized medicine world, it is never talked about. And I thought that was such an odd thing that we teach these things in school, but that we never practice in the real medicine world.
A
And
true
so that
disconnect, a real
this
disconnect. Like, I'll
disconnect,
educate you about it, but I'm not going to actually implement it.
yeah. That's the problem. And so I end up having to, start asking questions. Is the right field that I wanted to get in? And luckily enough, when I was growing up in South Korea, my aunt was a pharmacist as well as an herbalist. So she actually had a degree in Chinese medicine. She actually did acupuncture in her pharmacy as well, including dispensing medications. So both world, unfortunately, obviously in the US, they don't allow that to have happened. So I wanted a little more options, and I soon found my way down to Texas, and I was working and interning for this particular pharmacy. And this pharmacist actually had female clients coming to him hour, 2 hours away just to talk to him about nutrition and hormone consultation. I was like, this is an odd thing. How is a pharmacist able to do that? And that's how I got into it. And then I met, other great functional medicine pharmacists at that point in time. One of the particular name is Dr. Jim Lavelle. He talks a lot about peptides these days, but that's how I got into it. And I completed my fellowship in functional medicine through 84M. And afterwards, what I ended up doing was consulting clients in managing hormone replacement therapy. And this is also another limitation of functional medicine. We still end up having to put in the same centralized model within the functional medicine world just to give more supplements to fix the problem instead of really dialing in to getting things under control within us. So nowadays I talk about the four-dimensional approach of healing. The first thing we talk about is the environment. Second is the nervous system dysfunction. Third, microbiome. And then fourth is the actual cell membrane structure, right? All stemming into,
If I could just interrupt, for me, that is regulation versus function. right? And I've been trying to get John to realize that he does regulation medicine, not functional medicine, because he works on these four pillars. Because really what you're looking at is the terrain, the environment that that person and cell are living in, right? What's the second part of your pillar? I forget.
Nervous system dysfunction.
Oh, nervous system disorders. Does that have anything to do with your heart rate variability? Oh, yes, it does. Okay, third one is
Microbiome.
microbiome, which is all the spaces between the cells and what's living in them.
Yeah.
And that's your lymph system and your fascia.
Yeah.
And then what's your fourth one?
Fourth was the cell membrane.
The cell membrane. And that's now we're going to talk about the exchange of what happens over that cell membrane, dependent upon the environment, and then how mold and all that, those infectious agents get inside the cell.
Absolutely. So like that's a part that I didn't really dive into until later on, probably about 2-3 years after I met you, and then diving more into that particular area. And then also my clients really humble me, especially when you work with a mast cell activated issues, MCAS, that humbles you very quickly because you don't know what's happening.
Don't know what he's talking about. It's multiple chemical or
mast cell
activation syndrome, not multiple sensitivity, although it's very similar.
Very similar, but
it's very similar. It's like POTS. It's basically my nervous system is disrupted. I'm overwhelmed and I can't get it under control. And I have tons of inflammation that's just literally like a cytokine storm going on all the time. And it's a very small niche. And people like Dr. John, thank God, have decided to take it on because you need to understand physiology, not just regulation, to continue to help these people.
Yeah, it's a big part of a humbling moment that I end up having to soon realize that there's much bigger issue than microbiome problem. And so that's how I end up having to start out on functional medicine, helping clients deal with hormone replacement therapy. But there's always a cap in terms of how much you could help. And then the interesting about my story is that 2015, I actually had a heart attack. I had an 85% blockage in my left anterior descending artery, aka the Widowmaker, and I ended up getting a stent put in.
And how old were you, Dr. John?
I was 33 years old, actually.
33 years old with a heart issue that could have been terminal.
Yeah, so that was a wake-up moment of start questioning is, how's my lifestyle been? Is there anything that I missed, right? And thank God I had great friends and doctors end up having to resort to, and soon found out that after doing additional testing, I had very high levels of moldy antibodies, aspergillus, namely, and then secondly, I had a Bartonella testing positive, mycoplasma pneumoniae, Epstein-Barr, parasites, and heavy metals, right?
It's a party, like Dr. calls it. When you got 2 biological weapons or more, you've got a serious party. And Dr. John had all of them. He's a high achieving individual, and he likes to make sure that he doesn't just have one of the vectors. He's got all 5. EBV, mold, Lyme, and what was the other one? EBV, mold, Lyme, and
Bartonella.
Oh, Bartonella, the co-infection.
Co-infection on top of that. So that's a part it took me 2 years to clear out, finally getting healed, getting my life back. And then that ended up having to really open my eyes that in terms of doing functional medicine, it's not about optimizing your supplements. It's about finding the actual root cause of the issue. And this is a journey I mentioned about in the beginning of this podcast, that it's about the journey. It's not where you're going to be at the end. It's about the journey in terms of how each and every step, in terms of who you meet, what you deal with, where you are, and where you're going to go. Right? This is an important part that we have to address. So, and nowadays I work with clients deal with mast cell, mold issues. And anytime patient comes in dealing with gut issues, I just don't look at the gut itself. I look at the entirety of it, especially I mentioned about the 4-dimensional approach of healing, is that you have to get the question answered about your environment. How are you living? Where did you live before? How was your environment been? Was it feeling safe for you? Were your needs met emotionally? Right? That's a big component. And then that all stemmed into affecting your nervous system as well. If your nervous system is completely fried, constantly in a fight or flight state, you cannot regulate yourself, nor can you having to have the ability to get out of that cell danger response that Dr. Robert Navio talks all about, right? I lecture a lot on cell danger response. And the issue is that people are constantly in that danger state. followed by the microbiome changes that occurs. It's about the balance. It's not about eradicating parasites all the time. It's about the balance of the entire microbiome, right? We're supposed to be living together. It's symbiotically. It's just when you actually have a terrain issue, it's affecting the way that you are able to be resilient to handle all the different things actually happening within you. And then followed by the fact that danger state affecting the intricacy within the cell membrane structure, which is causing you to have lack of cell-to-cell communication, damaging the cell membrane structure, which is leading into malnutrition, as well as not able to detox correctly, and other ways is affecting that. As a result, you actually have a deficiency of nutrients, especially fatty acid issues, that I end up having to address all four of those things to get the patients back in order.
I so appreciate this approach. And if any of you hear my dog in the background, just like give me a pass today, because we got a lot going on in the office today. But that approach is so comprehensive, and I find that's one of the reasons we connected so well. I think because a lot of times with functional medicine, I think it's a fail, to be honest with you. In functional medicine, like you say, they're just kind of doing the same model with allopathic, and they're just like, oh, here's another Band-Aid, here's another Band-Aid, oh, you've got another issue, here's another Band-Aid, and let me optimize how many supplements you're taking. and it's same with hormones and HRT. I mean, I'm a 50-year-old woman through menopause taking no hormones, and there's a lot of people in our industry that are freaking out on me because I'm not taking any hormones, and I'm like, I feel great. My blood looks great. My CRT looks great. My regulation is great. I don't know. I don't think the deer get hormone replacement therapy, so I think I'm doing okay. But I'd be curious, and I'm just full disclosure here. I'm curious about what your take is on that. Does everybody need hormone replacement therapy when they go through a different stage of their life?
I'll be honest with you, if it was me 15 years ago, I would say yes. Now I say no. Here's a reason why.
I love that we are having this conversation. Please, let's discuss this.
Here's a reason why. It's about the overall intricacy of what's happening in your body. So especially for women, right? Especially for women, there are two things that you have to get it under control. Number one is your stress issue. So again, nervous system dysfunction, right? Stress leading into cortisol issues, that downward spot into causing progesterone deficiencies and all the other things leading into inflammation as well. And the second biggest thing is your insulin response, your metabolism, metabolic function. So if you could control those two issues, and one way to do it is to regulate your nervous system again, right? How do we get your environment to be in an optimal fashion to get you to the right path that you're looking for? Now, obviously, many of you could probably end up having to deal with being a mom, working into, having a job on top of managing a family. Really, that's a hard thing to say to some people, and I get that. But as long as you could tweak certain things, right, in terms of how well you're eating on a proper times, that's a way to self-regulating. Number two is sleeping at the right time. I recommend clients to at least start to shut lights off at least 2 to 3 hours before they go to sleep. Be in the complete darkness. Block out artificial lights as much as you can.
To really get the circadian rhythm to set, to get the melatonin to turn on. Am I right?
Things never I talked about 3 years ago. This is a complete different me at this point in time. Why? Because light in general affects your nervous system. LED lights, if you look at it, if you take an iPhone and then do a slow-mo video lapse of that particular LED light that's above you, you start noticing that the lights are flickering. That's a lot of dysregulation within your nervous system that you're dealing with. On top of the fact that when you are stressed out, having to deal with that stress threshold becomes less. So everything is effing you up. That's the big problem. And so that's the one part that you have to keep it under control. Light exposure is the big one. When you get home, 2 to 3 hours before you go to sleep, turn off artificial light. If you can't afford to buy these type of blue light blocking glasses, make sure you wear that on a daily basis. Every moment that you're going to be on a screen, right, indoors, that's something that you have to do. And then also go to sleep between 10 to 11 p.m. wake up when the sun is coming up so you can get the active sun exposure you're getting. Why? That near infrared light that you're getting from the sun is so powerful. It's self-healing. There's a reason why, if you talk about Ayurvedic medicine, it explains about how the body is overall connected to the sunrise and how that's all interrelated to our entire ecosystem and how we end up having to live. Because of the fact that we're so modernized and we're getting disconnected. And another issue is, the environment of technology these days is also affecting our nervous system as well. So if you could, as well as control that, right, and as well as learn how to breathe correctly. I love doing heart coherency breathing techniques because that if you end up having to have the disconnect between that coherency you're looking for between your heart rhythm and your brain, that causes more anxiety, less of a ways to managing stress. You are not able to concentrate as well. You don't have the overall motivation, the creativity that you need. Because why? The overall creativity and the presence comes from your heart, and that's missing.
And that's what Sound of Soul is based upon, right? When we got it, did we ever do a Sound of Soul?
No,
No.
no, no.
John, you got to get here sooner than later.
I
We've done
know.
blood, we've done flow cleanser, we've done
I know.
Vine, but Sound of Soul we've never done. That's nuts.
Like I said, I evolved so much in the last 2 years into the particular space. It's
Yeah.
crazy. And then
You really have changed a lot since even our last conversation.
yeah,
Breaking that ankle this year may have contributed to that.
I probably have. And the second part is your metabolism, right? Your
Yeah.
muscle is the biggest medicine that you could have, right? So it's not about how much supplement you're taking, everything to deal with your food, light, your muscle, your body, your nervous system. Everything has to be aligned to keep your body healthy. So not about effing buying a red light therapy. It's not about going to get some shitload of peptides. We're not talking any about this.
And it's not about just taking progesterone and
It's
estrogen
not.
because I'm in menopause now. I totally agree with you. And, Dr. Jack Cruz's work, which I'm sure you've looked into,
Yeah.
he's a neurologist that couldn't lose weight, for those of you that don't know. And essentially, he found how impactful light was. And he started a lot of the circadian rhythm biology that so many people do now, like Carrie Bennett and Dr. Catherine Clinton and Dr. John and myself and so many. I mean, I've been doing it for longer than that. But the point is that circadian rhythm stuff sets the regulation. That's the whole body healing. And we look at the alignment, and then the function can be created from the cell beyond because of the environment the cell's living in and the input that the cell's getting for it to go into the intracellular space and then perform properly. I'd love to talk a little bit deeper at some point, maybe on our second recording, about
Or second time you're gonna invite me.
yeah, the set. You can see we're real friends. The cell danger response
Yeah.
and what I'm going to call the modern day world, the modern day living, So I want you to just kind of think about that. So we're talking about that. But just real quick in regards to metabolic function and strategies, what strategies have you put in place for your clients as well as for yourself that really would you say are like the top three things? And they may be some of the things you just mentioned, but what are the top three things today? If somebody's listening to this podcast, they've never heard of you before and they go, okay, this pharmacist wants me off of pharmaceutical drugs. That's weird. This pharmacist wants me off of supplements and he's a functional guy. Wait, that's weird. And so what would be the three strategies that Dr. John would have most people doing, knowing, going to my next question about the cell danger response and the chronic exposure we have in the life we live, that you would absolutely make sure every single person does? If
First
you
thing
had
you
a
should,
magic wand and made everybody do these three things, what would they be?
first one is your protein intake. That's the number one, right? Protein is a key thing. There's also is a
Is that,
messenger.
is that because of the insulin resistance
Insulin
stuff?
resistance one, but also as a building block as well. A lot of people, especially if you're dealing with mold issues, you have trouble processing amino acids in the body, right? So key thing I always recommend is try to eat at least a gram of protein in an ideal body weight. Right? So about 30 to 50 grams of protein, depending on your body size, on a per meal basis, right? And then that's what you want to first start off as, and as well as eating healthy fat, right? A lot of the fat you're dealing with these days is very unhealthy. Talking about inflammatory seed oil. Not all seed oil is bad, right? I love using pumpkin seed oil, black cumin seed oil. Those are powerful, powerful oils to use and seeds. It's just that when you talk about the industrial hydrogenated vegetable oils, those are very inflammatory. Why? Because it uses hexane or other chemicals as an agent to extract those oils out, and those end up having to be embedding into your cell membrane. It takes about 6 months to clear them out naturally, right? This is why I do cell membrane medicine, utilizing phospholipids, use of different types of fatty acid, and looking at the balance of it all to replacing it and fixing that. Because why? Because when you have a dysfunctional cell membrane, you're not able to take in or take out some of the nutrients and toxins out. And secondly, it also affects the cell-to-cell communication as well. Cell membrane is the key in how you keep yourself resilient to the overall environment. The reason that we are sick these days is because the resiliency of your cell membrane structure is completely damaged from the overall biotoxin and environmental toxins you're dealing with. And then those toxicity causes a deficiency in your system, including fatty acid deficiency as well.
Listeners and viewers of the Energy Flow podcast, I'm only interrupting to tell you about the membership program that we launched a few months ago, where you can access all things energy, fascia, lymph, oxygen, and water, brought to you by the True Wellness team, myself primarily, with a lot of videos and a lot of blogs and a lot of recipes and all the things to support you to apply the science of energy in your everyday life, and how to do it simply and organized in a platform and with community. Once a month, this community gets together in a Q&A where you get to ask me questions. We've had beautiful interactions and beautiful questions already in just a few months. Join us. Become a supportive member here on the podcast for just $7 a month. You can be a tier 1 part of our Energy Flow forum, where you get to go a little deeper into these podcasts offered to you for free. Or for $23 a month, you can be part of all of the things that we just discussed. I look forward to seeing you on our membership platform and at our Q&A. You saw me get all excited when you were explaining that. You saw that, right? I was like,
Yeah.
oh, it's because I realized what I'd love for you to teach on our second part, which is what you taught me a couple years ago, which is how to make my own liposomals and how to drive nutrients into my cells by your very special technique.
Okay.
It literally was a game changer. And I remember that phone call because I was getting sick every time I got on a plane, and I was so frustrated. And I was like, Dr. John, what the fuck can I do? Like, why? What can I do? How can I up it? And he was like, oh, just turn it into a liposomal. And I was like, well, I'm not a pharmacist. How do I do that? And as he not only explained it, he gave the science behind it. I was like, this is brilliant, and we should teach everybody this. This was like 2 years ago. And as I sit here today, I'm like, oh, I'm sorry it took me so long to get here, but this is perfect timing, divine timing. And we're going to let everybody understand that on this, when, for those that are sponsoring the podcast with your $7, and then teach us as well what that does to help bring and drive down inflammation. Because it was a game changer for me. I mean, I feel like a little alchemist now at my house since I.
Very simple, right? Simple
it's
to ingredients.
Really simple, and it was a game changer.
Yeah,
so
simple to ingredients.
Go back to real quick to your mold exposure. So when you had mold exposure, you had Lyme exposure, and how did you find all that out? You did functional testing?
So my doctor ordered some blood tests to look at these things. Now, we didn't do any urine mycotoxin at that point in time. It was not available back in 2015. I think there was an infancy of the testing available. So we ended up doing a blood test to see antibodies. And when you're looking at Dr. Shoemaker protocol, they do look at sort of the blood markers to see if you're dealing with CIRS, right? Chronic inflammatory response syndrome, which is revolutionary in terms of explaining about the overall pathophysiology, but doesn't really explain about what's really happening with these type of different mycotoxins causing cellular damage in that sense of that, especially your fatty acid deficiency that causes, as well as damaging different intricacy part of your nervous system as well. So this is a part that I really work with clients on. And the second thing is I had done a IGenics BART fish test. It's a inflorescent in situ testing. And so when you look at this particular dye, the Bartonella pathogen lights up like a Christmas bulb. So, so that's how you end up having to detect it. Because why? Because doing conventional blood work looking at potential tick-borne related illness, there's a major limitation of these tests these days. So you have to work with these particular specialty labs
So
like IGenics or Vine.
Western blot test is not enough.
That's not.
IGenics has become the gold standard. And this is something they can do with you, Dr. John?
Yes and no. There are certain limitations as of what I could do these days. That's off topic, obviously,
State by
but
state
yes,
and all that
yeah,
stuff.
absolutely.
And I just want to encourage everybody because a lot of people after they see a podcast like this are like, well, I don't know you both kind of do the same thing. Who should I work with? Here, let me just be clear. We do transformational work at our office. We like to help you get unstuck. Like one of the things that Dr. John talked about is lipids and how important good fats are. Well, your lymph mobilizes your lipids. If you don't have good lymph flow, you don't have, even if you eat good oils, you're not going to absorb the good oils, you're not going to circulate the good oils. So all has to do with your lymphatic system, right? So what we work at is getting the energy to flow in the body, helping you transform. Then you work with somebody like Dr. John that's like, I mean, we have somebody here that does supplement reviews. I do some of them. But if you want to get to the nitty gritty of the pathophysiology and you want to do some of those assessments, that's where you would go work with somebody like Dr. John and go, okay, I want to get into it and I want to like dissect it and I want to start to get off my medications. And I can't do that. You got to do that with professionals that understand it because there's a lot of interactions, of course, with medications and supplements and so forth. And you want to work with somebody that understands both sides of that, both from the herbs, from the homeopathics, from the pharmaceuticals, and from all the peptides and all the different biologicals that there are these days, because they all have interactions and nothing is isolated. As Dr. John is saying, everything is a comprehensive approach. And if you're only looking at one slice, you could really miss a big piece of it. And I wanted him to bring up the testing because I think that's so important because people are out there getting a lot of tests, but not all tests are created equal either. Stool tests. What is your feeling on stool tests, Dr. John?
Stool tests, depending on what testing companies you're dealing with, but one of the things that I've been looking at is the microbiome labs, BiomeFX. The reason is microbiome is about the balance. It's not about one thing is higher, one thing is low. It's about the overall balance as well as what type of inflammation you're dealing with in the gut. And then third is the levels of particular short chain fatty acid you're producing, especially butyrate, propionate, acetate. Those are things that are very important to see how well these short chain fatty acids are present to protect your colon, as well as butyrate has a big role as a histone decarboxylase to break down some of the DNA damage that goes on as well. So your body already has this protective mechanism to deal with that. The issue is the amount of biotoxins and environmental toxins you're dealing with, and as was stressed, and the structural epigenetic change that goes on in the body, you're not able to produce these short chain fatty acids properly, including the fact that your levels of some of these butyrate or short chain fatty acid producing bacteria is also affected as well, namely Bifidobacter, for instance, right? So these are things that are intricate part that you have to look at. When you look at a person's stool testing, it tells a lot about how the person's eating, how well their nervous system is being regulated again, right? As well as the environment, and then what's really happening as in terms of cellularly as well. So I take that very deeply in that sense of that, and looking at other functional lab tests, looking at your entirety of your metabolic and looking at CBC and different inflammatory markers, that answers a lot of questions as well. And then if you want to go more specific into doing like mycotoxin, for instance, I love using Bible Wellness or real-time labs. Those ways end up having to look at specificity of those type of mold toxins. It's not about the mold, but mold toxins and how that is also causing multiple issues, including your hormone dysregulation as well. There's a particular mold toxin that are estrogen mimicking, right? So that has been shown to cause infertility in cows and pigs. Well, obviously, they're not going to do that in humans as a study, but you could extrapolate into knowing, okay, why is this patient client who's coming in? She actually has a history of miscarriages, already 2 or 3 times, and wondering and having all these symptoms. What's really happening? Well, that particular mold toxic can be a big issue. So that's something that needs to be addressed to find whether mold can be present in the house or the environment, and then also getting rid of that mold colonization in the body, right? Sinus, gut, right, everywhere else, and especially if you have active fungal issue on your skin, that shows that there's an overgrowth of mold issue going on in your body as well. So you got to fix all these things and then using proper treatment.
And you're going to teach a mold masterclass, you said, at the
Yes,
beginning?
I am. Yes, I am. So I'm going to be offering a mold course as of January. I'm actually going to be offering a huge discount for your listeners if you are interested. But that's something that I'm going to be doing for Black Friday and so on, because there's so many people that needing help, but because of the where I am, because they might be living in Europe somewhere, they cannot work together, and as well as could be cost, right? The cost could be a lot for them to work with a practitioner one-on-one. But if you're self-motivated, if you have tried everything and haven't really gotten any resolution, this is a course that I built because of the issue that I went through, as was working with different clients of really getting the step-by-step approach of dealing with these things.
And the propensity of mold. I mean, okay, so we are recording this on November 14th. In August, I went to Bali, to an international trip to Bali, Indonesia. And the first location that I was staying at, I was on somebody else's retreat, and I opened my hotel room. And the hotel was built in the 1960s, and the pink tile in the bathroom was still from 1960, but it was kind of like a pink and black bathroom at that point because it was black mold all over the bathroom. And I was like, all right, it's just going to be fine. I'm going to be here for a week. I'm going to keep the door open. I'm going to let fresh air. And it's all going to be fine. I regulate well. And I was perfectly fine. I was exhausted when I came home, but it could have been jet lag, could have been mold. It was fine. 3 weeks later, I went to Scottsdale, Arizona for an event. And I opened my hotel room and I was like, oh my God, it's so musty in here. I thought, and then I went to my friend's room and I was like, oh no, I don't even know how you're sleeping in this room. So, okay, 3 nights in another moldy facility with the window open. Okay, no problem. Dose makes the poison. I'm still doing good. Then 2 weeks later, I go to San Diego to another venue. And to make a long story short, I had heels on. My feet were killing me. I took my shoes off on day 2 and started to walk around barefoot on their carpet. Didn't know that it was moldy. That night, when I was complaining about how I felt, my friend who was there was like, well, yeah, because of the mold. They were trying to turn off the air conditioner because of all the black mold. I was like, what? I was sick for 4 days. That woman could not get out of bed for a couple of days. And one of my teammates that was with me was sick for 2.5 weeks after being in that San Diego event.
Oh,
And
God.
I literally, guys, I was in Arizona, supposedly dry, San Diego, supposedly perfect weather, and Bali, and I got mold exposure. Yeah, I live in the northeast of Pennsylvania, or northeast of the country. In Pennsylvania, he lives in New Jersey, and and I've been looking for a house for 5 months. You cannot almost find a house up here without a mold problem. I'm in an office building right now that I want to get out of because it's become musty. Like mold it's everywhere. There is
Yeah, it's
not a
everywhere.
state you're not in that you're in, rather, that it's not a problem.
Yeah.
For me, it's not, we are Aspergillus and Mucorracement and Penicillium notae. That's what we are, is non-pathogenic fungus in non-pathogenic form. But when it outgrows or we're exposed to it, then our own mold and fungus grows in our body and creates this cell damage, inflammatory experience. And we've got to learn how to live in this environment with it. And then we got to learn how to properly remediate it out of our environment and then out of this house. And so I highly encourage you. And I love what Dr. John said. Not everybody can afford to work one-on-one. And if you're self-motivated, we are giving you the information, our master classes, so you can do that stuff. So, self-motivated and move forward. So I also encourage you to follow Dr. John on Instagram, because not only is he highly educational, he's also very freaking funny, and he's a fun guy in general. But really, your education is, I look forward to seeing your post, because I always know it's going to be twofold. It's going to be the truth. It's going to be blunt. And it's also going to be very practical, common sense, applicable for people every day. And I appreciate that about you, John. So tell them where they can find you, your website, all your handles and stuff, and then we'll get to our part 2.
Yeah, absolutely. You can find me on my website is kimwellness.co, and my Instagram page is john.pharmd, PHARMD.
John.PHARM. I mean, we'll have it in the show notes, but that's why I was like, I never know how to find you, because I'm always looking for Dr. John, but you're in my feed. So anytime I try to send somebody, I'm like, hold on, I'll tell you what it is. And then
there's a whole side of it. Apparently, I cannot, even though I have a doctorate in pharmacy, I cannot use the word doctor anymore, because the Board of Medical Examiners now is going after non-MDs that are using doctors and finding, and yeah, it's a witch hunt.
It's a witch hunt.
Yeah.
Wow.
So anyways, that's why I had to drop the word doctor in front of.
We're swimming upstream regardless, and yes. I just really I appreciate you, John, and Dr. John, rather. Dr. John, I could call you that here still.
Yes.
I do appreciate you and everything you've done, and I just I connected you. You actually know him, a gentleman that just bought the Son of Soul, him and his wife Carrie Justin, out in Kansas City. He's a pharmacist, and I was like, you got to meet this best pharmacist. You want to be holistic. This is the guy you can do it with. And then as I pull you up on my Instagram, as I did, he goes, oh, I know Dr. John. And then all of a sudden he opens his phone. He had your contact in his phone.
That's funny.
Because he's the man. And, I just want everybody to know that Dr. John's become an international speaker. Tell them what you did this summer in England.
It was last summer, actually. I was actually invited to the Health Optimization Summit, and I spoke about mold in front of about 2,000 people on a crowd. So, it's a really exciting topic. And when you talk about, out there, especially England, 900,000 homes are actually dealing with mold issues, and especially level 1 toxicity at home, right? So people needing help in those areas, but they cannot find a right practitioner who's trained to be a mold literate. So this is the part that, and there's a main reason why I decided to make this course up, was because to help those people out there, because cannot find a practitioner to work with. And the issue is that I cannot work with international clients, so that's also limiting as well.
And always remember, when you go to do whatever with your mold, pump your lymph nodes, get that lymph open, get movement going so it can detoxify, right? That's always important.
Yeah, your lymph especially gets stagnant a lot of times because of mold, but mold also stiffens up your blood vessels, and it affects your fascia. It actually affects your soft tissue, especially your Achilles, right? So if you have a unexplainable rupture to your Achilles and tendons, mold issue could be a big one. So it can Bartonella infection.
Is that what happened?
No, I was trying to stop a car.
Yeah, I was like, I remember it being like a physical accident.
Yeah, it was a physical accident. I was helping a customer push his car, and the car rolled back on me, and I was trying to stop it.
I remember I was like, John, you're a pharmacist with a brilliant brain. Please don't do that stuff anymore. But, I was out walking my dog and broke my elbow this year. So, it is what it is.
Yeah, exactly.
So, yes. Well, thank you all so much for following us. And for part 2, what we're going to go through is with Dr. John. He's going to explain to us how to make a liposomal so that you can drive nutrition in your cell. And we're going to talk a little bit more about cell danger response and conventional living and why it contributes to cell danger response, and some strategies to unwind that for you so you are not over pharmacying yourself or adding one pharmacy to another or over supplementing yourself. You heard it here first on the Energy Flow podcast, the first of many, with Dr. John Kim and Kelly Kennedy on the Energy Flow podcast.
Thank you so much.
Well, champions of the vibe flow community, energy flowing through that body, thank you for sharing this time with us and getting through the entire episode today. I know time is what we're spending here as our currency on this planet as people, and it really does mean a lot that as we devote our time and energy into creating this content, that you stuck with us throughout it. So if you would like more on this particular subject from this expert and get that free gift, make sure to register for our Energy Flow Forum. And you too, with a very nominal price, can access all sorts of upgraded content and deeper dives into the very subjects that you love: energy, fascia, lymphatics, oxygen, and water. As you know, as always on this show and any content that we create, it is for your own health purposes. This is not intended to be advice or medical diagnoses or professional advice. It's purely information that if it resonates with you and you apply it and you upgrade, we love to hear about it. What a great coincidence, and we're happy to be on that journey with you. If this doesn't resonate with you and you know somebody it will, pass it along. And in the meantime, know that we truly are here to show you and explain to you and be with you through this lovely journey of life, and to share our experiences together and help each other upgrade, because that's how we're going to do this, together, collaborating with love at the center. I'm Kelly Kennedy, and I am so grateful from my heart to yours to share this time, energy, and space with you.